Ever wondered how surgeons perform complex operations without the patient moving a muscle? Neuromuscular blocking drugs, that's how. Let's take a moment to appreciate the complexity of the human body. Every movement we make, from lifting a finger to running a marathon, is controlled by a network of nerves and muscles working in harmony. But sometimes, in the interest of medical procedures, we need to temporarily halt this symphony of movement. That's where neuromuscular blocking drugs come into play. These drugs, often referred to as muscle relaxants, are crucial tools in the field of anesthesia. They're used to create muscle relaxation, allowing surgeons to perform intricate procedures without the risk of sudden, involuntary muscle movements from the patient. Imagine trying to build a ship in a bottle during an earthquake. That's the kind of challenge surgeons face without the help of these drugs. Neuromuscular blocking drugs can be divided into two main categories: peripherally acting and centrally acting muscle relaxants. Peripherally acting drugs work by blocking the transmission of nerve impulses to the muscles, while centrally acting drugs suppress the nervous system's activity, reducing muscle tone and reflexes. It's a bit like turning down the volume on a stereo. The music is still playing, but it's much quieter and less disruptive. But these drugs aren't a recent discovery. In fact, their use can be traced back to the Amazonian tribes of South America, who used curare, a plant-derived poison, on their arrow tips to paralyze their prey. It wasn't until the mid-20th century, however, that scientists began to understand how these substances worked and started using them in medical procedures. Neuromuscular blocking drugs have since become an indispensable part of modern medicine, revolutionizing fields like surgery and intensive care. But much like any other medication, they come with their own set of risks and benefits, which we'll explore in greater detail later on. So now that we know what these drugs are, let's delve into their fascinating history. Rewind to the 16th century, South America. Indigenous tribes were using curare, a plant extract, as a paralyzing poison on their arrow tips. This is where our story begins. Curare, a seemingly deadly plant extract, was used by indigenous tribes to paralyze their prey, but little did they know this lethal poison would later pave the way for a major medical breakthrough. Fast forward to the 19th century. Western medicine stumbled upon curare and its fascinating properties. Pioneering explorers who ventured into the South American jungles returned with tales of this potent plant extract. Naturally, it piqued the interest of the scientific community. In the hands of scientists, curare was not a weapon but a puzzle to be solved. They delved into its chemical structure, seeking to understand how it could cause paralysis. Through meticulous research and experimentation, they discovered that curare blocked the transmission of nerve impulses to the muscles, causing temporary paralysis. This was a momentous discovery in the field of pharmacology. However, curare's potential was not fully realized until the 20th century with the advent of modern anesthesiology. Scientists began developing synthetic versions of curare, which were safer and more predictable. These synthetic compounds, known as neuromuscular blocking drugs, were a game changer in the operating room. Neuromuscular blocking drugs made surgical procedures safer and more efficient. They allowed surgeons to operate with minimal muscle resistance, reducing the risk of complications. These drugs also made it possible to control a patient's breathing during surgery by temporarily paralyzing the muscles involved in respiration. To say that neuromuscular blocking drugs revolutionized surgery would be an understatement. These compounds, derived from a poison used by indigenous tribes centuries ago, have become indispensable in modern medicine. They are used in a variety of surgical procedures, from minor operations to life-saving surgeries. From arrow poison to a life-saving tool, neuromuscular blocking drugs have come a long way. From the jungles of South America to the operating rooms of the 21st century, the journey of neuromuscular blocking drugs is a testament to human ingenuity and the relentless pursuit of knowledge. But how exactly do these drugs paralyze muscles? Well, the magic of neuromuscular blocking drugs, or NMBDs, lies in their unique mechanism of action. To understand this, let's first take a quick trip to the junction where our nerves meet our muscles, the neuromuscular junction. Here, our nerves communicate with our muscles by releasing a neurotransmitter called acetylcholine. This acetylcholine then latches onto receptors on the muscle, triggering a cascade of events that leads to muscle contraction. Enter NMBDs. These drugs work by interfering with this communication line. But not all NMBDs are created equal. They fall into two main categories: depolarizing and non-depolarizing types, each with a distinct mode of action. Depolarizing NMBDs like succinylcholine impersonate acetylcholine. They bind to the acetylcholine receptors, triggering an initial muscle contraction or depolarization. But here's the twist: these drugs don't detach like acetylcholine does. They stick around, keeping the muscle in a state of constant depolarization, which paradoxically results in muscle relaxation. On the other hand, non-depolarizing NMBDs, such as rocuronium, act like bouncers at a nightclub. They block the acetylcholine receptors, preventing acetylcholine from binding and triggering muscle contraction. Without this signal, the muscle relaxes. So, whether it's by mimicking acetylcholine and overstaying their welcome, or acting as gatekeepers and blocking acetylcholine's access, NMBDs effectively interrupt the conversation between our nerves and muscles. It's worth noting that while they may sound a little intimidating, these drugs are invaluable tools in modern medicine. They're used in a range of procedures, from minor surgeries to life-saving interventions, allowing doctors to safely and effectively manipulate muscle tone. In essence, NMBDs are a bit like the puppeteers of our muscles, pulling the strings behind the scenes to control muscle movement. Although they work differently, both types of neuromuscular blocking drugs achieve the same result: muscle relaxation. Today, these drugs are indispensable in medicine. Neuromuscular blocking drugs, having been harnessed over the years, now play a significant role in modern medicine. They've become a cornerstone in the world of anesthesia, paving the way for safer and more manageable surgical procedures. Imagine a complex surgery where precision is paramount and the slightest involuntary movement could have serious consequences. This is where neuromuscular blocking drugs come in, rendering muscles temporarily unable to contract, providing surgeons with a still canvas on which to work. But their use doesn't stop in the operating room. In the realm of intensive care, these drugs have a vital role to play. They are employed to ease the process of mechanical ventilation, particularly in patients who are struggling with respiratory conditions. By relaxing the muscles involved in breathing, neuromuscular blocking drugs allow the ventilator to take over, ensuring the patient's body gets the oxygen it needs. In addition to these uses, neuromuscular blocking drugs are also used in diagnostic procedures. For instance, during electroconvulsive therapy, a treatment for severe depression and other mental health disorders, these drugs prevent convulsions, making the procedure safer and more comfortable for the patient. Moreover, these drugs are also used in certain procedures to manage muscle spasms, such as in tetanus or other neurological conditions. By blocking the signals that cause these spasms, patients experience significant relief. In essence, neuromuscular blocking drugs have become a versatile tool in the medical field. They've made surgeries safer, improved the effectiveness of intensive care, and have even found a place in the treatment of mental health disorders. Their use in modern medicine is a testament to the progress we've made in understanding and manipulating the human body's intricate systems. We've come a long way from their discovery, and their evolution shows no signs of slowing down. Indeed, neuromuscular blocking drugs have revolutionized medicine. Their role in the world of healthcare continues to grow and adapt, and we can't wait to see where this path leads next. As we look forward, what might the future hold for neuromuscular blocking drugs? This is a question that captures the attention of researchers, medical professionals, and those with a keen interest in pharmacology. The answer, while not entirely clear, is certainly promising. Ongoing research is pushing the boundaries of our understanding, and the potential future uses of these drugs are expanding. Today, we'll delve into what the future could look like for neuromuscular blocking drugs. One area that holds substantial promise is the development of drugs with fewer side effects. This is particularly important for patients who require long-term use of these drugs. The goal is to create drugs that can effectively block neuromuscular function, but with minimal impact on other body systems. In addition, researchers are exploring the use of these drugs in treating a wider range of conditions. While they are currently used primarily in anesthesia and to treat certain neuromuscular disorders, the potential exists for these drugs to be beneficial in other areas as well. For example, they may have potential in managing chronic pain or in treating certain types of muscle spasms. Another exciting area of research is the development of more targeted drugs. These would work by blocking specific types of nerve receptors rather than having a broad effect. This could result in more effective treatments with fewer side effects. The importance of continued study in pharmacology cannot be overstated. As we learn more about the intricacies of the nervous system, we are better equipped to develop drugs that can safely and effectively manipulate its function. The potential for new discoveries and advancements is vast. The story of neuromuscular blocking drugs isn't over yet. The future promises exciting developments. As we continue to explore and understand the world of pharmacology, we can expect to see significant advancements in the realm of neuromuscular blocking drugs. This is an exciting time to be part of this journey, and the future certainly looks bright.